My name is Jim Krause, and I'm an investigator in the area of spinal cord injury. And this is one of a number of videos that are directed towards professional audiences, also some directed toward people living in the community with spinal cord injury and their families. And so what I'm going to talk about in this particular video is a model that we developed for the investigation of risk and protective factors for secondary conditions and mortality after spinal cord injury. So we know that people with a spinal cord injury have certain characteristics, their age, gender, race, ethnicity, and we know that ultimately, as with everybody, people die, and unfortunately there is a diminished longevity after spinal cord injury, but we don't see it in all people. People still have varying degrees of life expectancy depending on a number of characteristics, and we developed this model as a framework for helping us to investigate and understand secondary conditions and mortality. So if we look at the model, we start out with biographic and injury characteristics and mortality. We wanted to know what would precede mortality. And so the next stage of the model is health factors. And so obviously there's some sort of health factors or the development of secondary conditions which precipitate mortality. And if we can identify these factors, then we are in the position where we can begin to address them or identify prevention strategies. So then the next question is, what leads to differential health after spinal cord injury? What actually leads to the development of secondary conditions outside of the injury itself? And the next class of variables that we look at are risk and protective behaviors. A risk behavior is anything that leads to an elevated risk of an outcome, either a secondary condition or mortality. So something such as smoking would be a risk behavior. It would lead to an elevated risk, again, for particular secondary conditions as well as for mortality itself. Another type of protective behavior is something that would diminish the risk or lead to a lower risk of an outcome. So a favorable nutrition or exercise might be examples of protective behaviors. The next thing we looked at, the next level of the model, and it completes our basic structure, are psychological and environmental factors. So psychological factors are things like personality that might predispose an individual to a certain behavioral pattern. Environmental factors are things such as availability of health care or social support. And these types of things we look at again in relation because they create opportunities. Someone may have an opportunity to go to a clinic, which is a behavior, go to a clinic to seek preventative care. And others may not have that opportunity because they don't have the resources. So in summary, just for the research model itself, an individual has certain characteristics at injury, they have certain psychological characteristics, they return home to a certain type of environment. That all these factors lead to particular sorts of behaviors, which in turn affect health, the development of secondary conditions such as pressure ulcers, urinary tract infections are examples, and those lead to the risk of mortality. Individuals that have favorable characteristics obviously are going to be healthier and live longer, and those that do not have the characteristics, be they the health factors themselves, the behaviors, or what other variables, they will not live as long.